Okay, it is 9 o'clock, and I want to call the meeting of Humboldt County Health Board, Board of Health to order. First thing we'll do is a roll call. Dr. Stringham?
Good morning, I'm here.
You're muted, Dr. Stringham.
Mr. Chair, this is Sheriff Allen. I did hear Dr. Stringham.
You cool if I just hang out with you for this?
Karen, can you respond? Karen Bannister, can you hear us? Can you talk?
Yes, I can.
Everybody's muted. Okay. Let me just see if something's going on this end here. Yeah, Dr. Stringham, you're unmuted on my end, so I should be able to hear you.
Yes, how does this sound?
I can hear him.
Well, I heard him just a few minutes ago, so. I don't know. Hey, Rick, we're trying to start this meeting here. Everything looks right, but we cannot hear anybody from the outside talking to us. Any thoughts on that as to what's going on? Okay. Hey, how are you? Yeah, so they can hear us, but we can't hear anybody trying to talk in. Okay, that'd be great, Dave. Thank you.
You see that, Dave? Is that okay to run that link from the meeting? I can't get on.
Yeah, because I've got quite a few people in. It's just, and I see their lips moving, but I can't hear them. Do you have the password?
Yeah, it set up last time.
Okay. Hey, the other thing, we've got a few people trying to get on with their tablets and can't get onto the network here, the Humboldt County network. So could you check on that, please? I'm missing here. Hey, Dave. Yeah, so I'm in the meeting here. And they can hear us, but we can't hear anybody coming in here.
You're running this is not support audio.
Right, I'm not putting audio on, but normally I've just got this in here so I can put up documents. But I got everything's done here.
You're running the meeting from here.
Yeah, meeting's running from here.
Okay.
So, Oh, wait a minute. Oh, whoa, 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 whoa. Now I see what's wrong. Hang on, here's the problem right here. This is the wrong one.
Oh, you're using the phone?
Oh, that's the problem. That's the problem. Fix that pretty easily. I'm in the wrong, let's see here. Should show up there now. See, that's a different meeting. That's probably because it's after the hour, I think. This is a problem. Yeah, I don't know how to fix that. I think once you go past the hour and you try to call in or you add somebody, it's too late.
Yeah, I don't know.
I'm afraid if I set a new one, everybody else would have to dial back in.
Right.
So,
Yeah, I don't know how to solve that.
but so many, okay, I just got to figure out. This technology stuff is just, it's great when it works, but
Great and drives you crazy.
yeah, it's like, what am I going to do here? So that's the meeting, but it's got to be onto there. And I'm like, why would it have? It's just painful. Send update. Come on, baby. Karen, maybe she has to do it. It's declining.
Yeah, that's what I was wondering about if he was trying. You have to run the meeting off of the room PC. This PC is only for document sharing. Just in the meeting up here. That's okay. You want me to join this?
Yeah. There we go.
Okay, I can explain what happened to you.
Okay, hang on one second here.
Everybody needs to be.
Change your volume.
I already did that right here. I did. What do you mean? There. It's already out. X out.
Click it again. Yeah, see.
Just don't understand why it does that. Ladies and gentlemen, can you hear us now?
You still have, somebody has a computer in the room that has audio.
Do you have your audio on?
Is your mic on?
Your mic's muted.
Just got some.
Yeah, hit that off. Yeah. Dr. Stringham, can you respond? Let us know you hear us.
Yes, I can hear you. I could hear muffled voices in the background. It sounds like the primary meeting room microphone positions may be an issue. A lot of echoing, a lot of microphone feedback, and very, very muted, very soft voices.
Okay, is this better now?
A little bit, yeah.
Well, for right now, I think we're ready to go.
Okay, we'll start this meeting of the Humboldt County Health Board. It is, what time? It is 9:13. Apologize for the late start. New technology, we'll get through it one of these days. First thing we'll do is have a roll call. Dr. Stringham?
Yes, good morning. I'm here.
Yes, Sheriff Allen?
Good morning, I'm here, thank you.
Commissioner Hill?
Yeah, I'm here.
Commissioner Haas?
Here.
Commissioner Cherry?
Here.
Commissioner French?
Mr. Chair, Mr. French is en route here, so
Okay.
he should be here momentarily.
All right, really noted. The next thing we'll do is the Pledge of Allegiance. Would you all please join me in the pledge of our flag? Thank you. Public comment. Before we get into that, our Assistant District Attorney, Wendy Maddox, has some things she'd like to address.
Wendy Maddox, Deputy DA for purposes of the record. I want to make everyone aware, including this board, that when there's public comment, the law allows you only to respond with, thank you very much for your comment. It is your choice whether or not you want to answer. And it's, as I've told all of you, it's really difficult sometimes when you're on the spot to give accurate and detailed answers. So if you would like to respond to a comment of the public, I would just ask you to address the chairman and say, may I respond, so that he goes to you. The other thing that I want to make you aware of as a board and also public, that restrictions on public comment are permissible if they are reasonable and viewpoint neutral. As set forth in Kent v. Santa Monica Rent Control Board and other federal cases, a public body may limit the speech of members of the general public during a public comment, provided that the limitations are both reasonable and viewpoint neutral. Furthermore, viewpoint neutrality is not synonymous with neutrality as to content or subject matter. Although a public body may not stop a member of the public from speaking because the body disagrees with a viewpoint expressed, the public body may limit public comment to the subject at hand, limit public comment to a reasonable amount of time, and restrict public comment that is repetitious or irrelevant or that includes personal attacks or slanderous remarks.
Okay, thank you, Wendy. And I would like to say that let's try to keep our public comments to what's on the agenda so that we can get through this meeting and move on. If you have other things you want to say, I'm certainly not going to stop you, but I would ask that of you. First, on the order for public comment, is Nicole Maher would like to address.
Thank you, Commissioner Tipton. Can you hear me okay?
Yes.
Great. Good morning, everybody. Thank you for the opportunity to share this public comment period. My name is Nicole Maher, and I've served as the Humboldt County Public Information Officer for our local COVID response since April 2020. Today, I want to apologize for any upset the business educator letter caused. I apologize to the business community for launching something that, for some, must have felt like an asteroid from space, unexpected, unannounced, and unwelcome. I apologize to our health board, including Dr. Stringham, the Humboldt County Commissioners, and Sheriff Allen for causing them to be unfairly characterized as a result. And I apologize to Dave Mendiola, who has unfairly borne the brunt of this. I noted from Monday's comment period at the Humboldt County Commission meeting that the public has a lot of questions, and I likely have some of those answers. And so I'd like to share a quick summary of events. Nevada has a COVID-19 mitigation and management task force that monitors testing numbers, case rates, and testing positivity rates in each county. If a county flags for 2 or 3 of those measures for 2 consecutive weeks, they have to submit a comprehensive plan to the state detailing what they will do to reduce their transmission risk. Humboldt was initially flagged in August, then October, and finally in November, where we remained until this past Monday, when we were finally released after 13 weeks. In mid-November, following many conversations with the state, we were told that we must include an enforcement piece, or there would be consequences. I was very worried what those consequences would be. At the same time, there was absolutely no appetite on our part for any kind of enforcement. In April 2020, we had launched a business educator program to help local businesses deal with the evolving COVID pandemic. While the initial program lasted a very short time, we thought to resurrect the program from an informational standpoint. Never at any time was there talk of fines, suspending licenses, sharing information with the state, or anything else supportive to business. The goal of this program was to provide information, PPE, and help businesses avoid any run-ins with OSHA. We submitted our plan to the state, legitimately trying to strike a balance between what state officials would accept and what we were required to provide. Our main language in the plan states, quote, send out a letter to all businesses in Humboldt County outlining expectations for business/organizational virus mitigation measures, end quote. And so that's where the checklist came in. It was an attempt to share the state's compliance expectations, although internally we really hope to use the form as a way to help businesses avoid an OSHA visit. The Humboldt County Health Board and the state approved the plan. 3 days later, on November 22nd, the state began a series of pauses that continue today. While the state is in pause, counties don't have to report back to the state task force. Because I knew the state wouldn't be requiring a plan update, I delayed the letter project. However, once we got to January and began to see declining numbers, I suspected the pause was going to end. I was worried that noncompliance on our part would result in negative consequences for our board, for our county, our health board, and especially our businesses. Ironically, I was also worried that our health board and others would be upset the letter had not been sent. I drafted the letter trying to strike a balance between what would satisfy the state and what would be helpful to business. The letter was approved to move forward, and we sent it out using the same business list that we had used in April to send out the first business educator program letter. One thing that hopefully will be helpful to understand is that sending out a letter did not constitute a procedural breach. Over the past almost year, we have sent out many letters to the governor, to businesses, to residents. We've also sent out hundreds of press releases. In each case, drafts are reviewed, modified, and approved by a team specific to that project. Sometimes that has included members of the health board, county staff, emergency management, community health, and district attorneys. With regard to the case updates I send out nearly daily, it's always Dr. Stringham and Wendy Maddox. We've had good success with that process, but a broader review of this letter could have helped bring everyone to the same page. I am the county's main COVID communicator, and I'm sorry I did not recognize that. Some have characterized this letter as evidence that our county officials do not support local business or this community. Nothing could be further from the truth. In fact, while I haven't had experience with our two new commissioners, Commissioners Tipton, Brent, and Jerry, Dr. Stringham and Sheriff Allen are staunch defenders of local business. Dave Mendiola is a staunch defender of local business. That truth has been reiterated and solidified and cemented over and over and over again for me in every meeting I've attended or group conversation I've participated in. Not only that, they have done what I believe is a stunning job working to facilitate a protective and caring environment for local citizens, especially those who are most vulnerable. I hope no one will
Hey,
allow this
Nicole,
letter to bring, yeah,
can you hang on a second? We're having some
sure.
audio and you sound like a robot at times.
Okay.
I think it's your cell phone. I don't know if you can call in from your home line. It might be better because it's very muffled.
You know what? I'm not on my cell phone. I'm on the computer, but I can call in on my landline. Would that be better?
Yeah, and we might want to do that and then come back to you because it started out pretty good and then it got muffled.
Okay, you bet. I'd love to do that.
Thank you. Yeah, we just started. Yep, she's the first one. Yeah. Yeah. Do you want to open up to other public comment while we wait?
Sure. While we're waiting for Nicole, we'll move forward. And I want to just read the public comment portion of this first, just so it's on the record. General public comment is designated for discussion only. The public has the opportunity to address the board on any matter not appearing on this agenda. However, no action may be taken on a matter raised until the matter itself has been specifically included on the agenda as an item upon which action may be taken. And then on top of that, I have been received messages and I've heard things that we might be talking about employment here, and we're not talking about employment of the county manager or of Nicole Maher. Those are county matters. Those are not county health board matters. So this is a county health board meeting. So at that point, I will take public comment. Does anybody have public comment they would like?
Mr. Chair, I think she's back. Nicole, are you back? I saw a number come in. Maybe not. Go ahead. I'm
Are
sorry.
you there, Nicole?
I am back if you can hear me.
Okay, carry on.
Okay, I'm not quite sure where to continue.
Nicole, Dave
Yeah.
here. What I would suggest is you started to talk about the governor announced that February 15th we would resume meetings. So we decided to launch the letter.
Okay, perfect. So I'll just start there. So just as a review, once we got to January and began to see declining numbers, I suspected the pause was going to end. And I was worried that noncompliance on our part would result in negative consequences for our county, our health board, and especially our businesses. And if you heard me say this, ironically, I was also worried that our health board and others would be upset the letter had not been sent. So I drafted the letter trying to strike a balance between what would satisfy the state and what would be helpful to business. The letter was approved to move forward, and we sent it out using the same business list that we used in April to send out the first Business Educator Program letter. One thing that hopefully will be helpful to understand is that sending out a letter did not constitute a procedural breach. Over the past almost year, we have sent out many letters to the governor, to businesses, to residents. We've also sent out hundreds of press releases. In each case, drafts are reviewed, modified, and approved by a team specific to that project. Sometimes that has included members of the health board, county staff, emergency management, community health, and district attorneys. With regard to the case updates I send out nearly daily, it's always Dr. Stringham and Wendy Maddox. We've had good success with that process, but a broader review of this letter could have helped bring everyone to the same page. I am the county's main COVID communicator, and I'm sorry I did not recognize that. Some have characterized this letter as evidence that our county officials do not support local business or this community, and nothing could be further from the truth. In fact, while I haven't had experience with our two new commissioners, Commissioners Tipton, French, and Cherry, Dr. Stringham and Sheriff Allen are staunch defenders of local business. Dave Mendiola is a staunch defender of local business. That truth has been reiterated and solidified and cemented over and over and over again for me in every meeting I've attended or group conversation I've participated in. Not only that, they have done a stunning job working to facilitate a protective and caring environment for our local citizens, especially those who are most vulnerable. I hope no one will allow this letter to bring those loyalties into question. I know we all love Humboldt County and hope to see brighter days ahead. That's certainly my hope as well, and I'm happy to do anything to help that happen. Thank you for allowing me this time to share.
Thank you, Nicole. Now we'll take other public comment. I'm sure we have different lenses that each one of us are looking through here. So, Don, would you like to come up?
This won't take long. It'll be quick. John Avrant, the Martin Hotel. Just 4 points today. First, I want to thank each and every one of you and Dr. Stringham and Nicole and the sheriff. When I look at our current numbers and the way they are trending down, you folks are doing a great job. And we need that to have our businesses live. So thanks. I would like to see, as I said in the commissioners meeting, I'd like to see the letter retracted. Officially retracted, not modified. As I said in the commissioners meeting, the resolution that I have read really is useless because it's like we're sending something to Carson City and saying, please stop doing what you're doing. That will have no effect. This is just little Humboldt County. I would hope in the course of this meeting that we can find a way, or you guys can find a way, to put some teeth into a resolution. My opinion is the teeth that I need is the words that I saw in both White Pine and Lyon County resolutions, and that is that you encourage businesses to adhere to the practices that the state wants, but also encourage businesses to do business according to their business model. That's very, very important for JC, for me, for restaurants, for every business where a group of people have to get together and operate. For example, I would love, as the Star does in Elko, be able to offer my patrons the choice of distanced seating or family style. They want distance, we give them distance. They prefer family style, that it's their choice. But that's my business model, and we have suffered for a year by not being able to do that. The last thing that I have is it does us moderate good, but not enough, to have some changes in the resolution and have some support from the board. And Nicole, don't take this wrong, the communication that comes out from the board to the community on Facebook and other means, all that anybody ever reads is how many cases, and then they move on to the next article. What I would like to see, and I have shared this with Commissioner Haas and Commissioner Hill, I would like to see something, whether it's on Facebook or in the newspaper, that is more concise, more bold, easier to read, no text, simple, straightforward numbers. This is how many people we have cases. These are how many people who have died. This is, and the important one is the ages who have died and the comorbidity who have died. What we have to do is present a safety message to our citizens and our potential customers so that they can see actually 10 people have had cases. I don't even know if any of them died. 10 people have had cases related to a business. They need to understand that. That's it. That's all I have to say. Thank you very much.
Thank you, John.
Have a good day.
Thank you, John.
Yep.
Other public comments? Please come forward, state your name for the record.
Catherine Hall. Can you hear me okay? I was going to be more prepared and I didn't write anything down, but I fully agree with what John said. But aside from the numbers and all the negativity that we are just constantly given the fear about this virus, we don't receive any information regarding survival rates and things of that nature. It is really just fear driven from this board also. I think that also having one medical professional on the board does not do this community any justice. It would benefit to have a secondary opinion. I think when we rely on just one person, there's a lot of power there. There's no balance. So that is an extreme concern to me. The other thing is I understand state mandates and all of that, but we are still a free people. We have our community, and I'm sure there are things that we can do to stand up and say, no, this isn't going to work for us. And with a 98, 99% survival rate, I'm really not even sure what we're doing here. And the amount of money that we have spent on the professionals in this community, it's concerning because there's so much control coming from one person and telling us what we can and can't do. My kids going to school with a mask 3 hours a day is absolutely ridiculous. And I would like this board to look at all of the information, not just from one opinion, but several, because there is a lot of information out there. And frankly, I don't even want my child in school with a mask on. And the only reason that I let him attend is because he needs to have a little bit of social interaction with other people besides his family members. I am not going to stay at home to stay safe with a virus that has a 99%, 98, right, at probably the least, depending on how old you are. And to continue to drive that into the community, it is not okay. And this is causing a lot of depression, anxiety, misbehavior, because we are social beings, like Lisa said the other day. And children especially, it is ridiculous what is happening to these kids. So that's something that I think this board should look at. More information, not just one opinion. There is so much information out there. And whether you agree or not, the numbers tell a different story than what we're being told. And we have a governor, I understand that. We also have a voice, and we get to say. Thank you for your time.
Thank you, Catherine. Elaine?
My name is Ella Height. I have a few comments. I am with this young lady. All this fear mongering that's going on is very, very disturbing to me, considering the fact that I know of two people. Now, I don't know if the one lady was just marked in Reno, where she was in a care facility there, or not. I don't know if she was marked here because she was actually a resident of Humboldt County. And I know another lady that was actually here. Both of these ladies were clients of mine, so I know exactly what was going on with them. On the death certificate for the lady that died in Reno, they put died of COVID. No, she didn't. She died of pneumonia due to complications from the trach that was in her throat from cancer surgery. That's why she had been moved to Reno, because she needed it to be suctioned out a lot, and she kept getting pneumonia. She was already in the hospital with pneumonia from the trach again when the COVID thing came out, but they put on her death certificate, died of COVID. Another lady that was in her 50s who had been down for another treatment to Carson City for cancer, that was one of my clients. I shopped for her. I took her groceries to her room and put them away because she was in such bad shape, and she was trying everything she could to stay out of the hospital. She had been in the hospital almost 5 weeks because she could not take the pain anymore. They would not give her enough pain medication. I mean, her whole entire body was black down the wrong side from the radiation treatments. And she went to the hospital so she could get enough pain medication to deal with the pain. She was in the hospital for almost 5 weeks. And gee, when she died, it came out in the paper she died of COVID. Of course, they didn't name her, but I knew who it was. And I also know her sister, who they had taken, because she had put me on her advance directive, and they told her I couldn't be there, probably because I've made some scenes at the hospital before over stuff that was done. But anyway, and they put her sister, who was back east, on her advance directive. Well, I just happened to be in touch with her sister. The lady did not die of COVID. She died of cancer. I know of 2 young women that went on their lunch break to get COVID tests. They had filled out the paperwork. They did not get the tests because they had to get back to work. A week later, they got letters in the mail telling them they tested positive for COVID. I just want to know how much we have that's real and how much we have that's a crock of, well, I'm glad I'm wearing my boots. Have a great day, gentlemen.
Thank you.
Hello, JC Jackson here. Business owner downtown of Bacara and formerly La French Twist. First of all, I want to say that this can't be easy for anybody, especially in your positions. I can't imagine trying to run a whole county, or a country for that matter, with our presidents. And I want to say thank you to all of you for what you guys are trying to do. I think it's really hard to be in a position where you're trying to make decisions for many people, where everybody has their own ideas of what is best for them. And Dr. Stringham, I want to thank you because I know that you've really worked hard and tried to do what you can. And we all have to remember that he's also following guidelines of the CDC and the medical boards and things that he has to do. So I hope that when we discuss things today, that we take that into consideration for him as well. And I'm talking to the crowd. I guess what I want to say is that with all this, I think people have felt like they have lost their voice. And that letter, which was a mistake, that's where we really felt that we had lost our voices. And I think retracting it fully would be the best thing for all of us. I also think that we also need to realize that we are all adults here. And I think we're just getting to that point where we'd like to make decisions for ourselves. Whether we choose to wear a mask or we don't. Whether we ask our patrons to wear a mask or we don't as business owners, that we follow our own business guideline and what is best for our business so our business does not go under. Because I'll tell you, it's hard, gentlemen and ladies. As business owners, the restaurants have been hit some of the hardest because down to 25% capacity. I mean, when the governor said that, it was like, are you kidding me? We might as well just close our doors. We had to lay off 3 people, even though we're getting, we're supposed to be getting money to help. Obviously, no one's ever ran a restaurant if they think that $10,000 is going to help you. $10,000 barely covers a week of what we need. and it's helpful, and I'll take it because I need it. But it's just not enough, honestly, when you're used to making a certain amount and you're cut down by a quarter of what you were making. And I see it just looking at my books, and it's hard and it's terrifying, especially when you've put your heart and soul into something and your money into something, your life savings or, your inheritance or whatever it is, and it's going to be potentially taken away from you. And this is what you've been doing for the last 12, 15 years of your life, running your own businesses. And now what are you going to do? Because you don't have money to start up anything else. And I'm passionate about what I do. I believe in all the business owners here. I always say there's enough business for everybody in anything you start if you have a good business plan. But at some point, we have to start making decisions for ourselves, and we have to be allowed to do that. It's not always going to be the right decision, as you guys don't always make the right decisions for us either. But I'm hoping that we will take that in consideration when we draw up the plan with Lyon County and White Pine and Elko, that we look at what's best for our community and we start letting our business owners make the decision what's best for us. Thank you, and thank you for your time.
Thank you, JC.
Thank you, Jason.
I'm going to be brief today. I just want to add a couple things.
State your name, please, for the record.
My name is Jill Stepper. After our meeting the other day, there was a lot of thoughts that have gone through, and I've talked to several people, and I understand the situation that you guys are in. I understand the fact that the state is coming down and everybody has to answer to them. However, my thoughts at a local level, we've voted all of you in, we've hired people to be our voice. And just because our governor and different ones that are on the different staffs with Secretary of State and whoever, just because they're telling us that we have to do something, if they told us, tell those people to go jump off a cliff, are you going to go along with it? You think it's a good idea? No, you're not going to tell us to all go jump off a cliff. The thing of it is, we need you. We've, at a local level, we've hired you, we voted you in to be our voice. And we need you to be our voice. The government is not always right. And what might be good for a bigger area is not necessarily good for our small community. We need you guys to fight and be our voice. So if the governor's office and everyone's telling you what you need to do to shut down the community, we need you to stand up and fight for us. We can't just have letters coming out willy-nilly to every other business, who knows what businesses all got them, and scaring everyone and holding everyone down. That's just creating havoc through the whole town. We need everyone to be able to work together. We need unity, and we need transparency. We need everything that's going on in this community be transparent and bring the community in and involve everyone so that everyone feels comfortable with what's happening and know that you guys are fighting for us. That's really what we need. And that's my only thoughts today.
Thank you, Jill.
Thank you.
Thank you, Jill.
I'm glad I'm on this side of the table. I'm not your side. I can tell you that much right now. Jill Chatfield, county resident. I just have two things. One is I would like to know what was the information going to be used for that was being collected on the forms? If it was just statistical, okay, but then why put the name of the business on the form? What was the end purpose of that information? Scrap paper, a list? I don't know. And I don't know if any of you know.
Mr. Chair, I can answer that question.
Please.
So, Jill, the plan was to do nothing. Yeah. Only thing we would report, our plan to report when we finally did report was to say, hey, we visited X number of businesses and we found no problems. That's honestly what our plan was.
Okay, I appreciate that. And I believe Mrs. Maher stated that we were threatened with consequences if we didn't do something. And this letter was a result of that without knowing what those consequences were. If I was in that position, I think I would have said, and if we don't, what happens?
I can answer that.
Sure, thank you.
On one of the meetings that I sat in on with the governor's task force, they had asked if we wouldn't like more help from the state for enforcement. And I specifically told them that we did not want that help. And that's basically what this letter was to try to appease them enough to leave us alone here so that we could handle it ourselves.
Didn't work out so well. Well, I just think anybody who was involved with drafting this letter, I don't think anybody said, let's go out and make everybody pissed off. I know nobody's going to go do that. However, if whoever drafted this letter in this form, whoever thought it was a good idea is so misguided when it comes to the public they're supposed to be representing. I personally think they should be removed from their position. That's all I have to say. Thank you.
Thanks.
Morning.
Good morning.
Morning.
My name is Wayne McKenzie. Can the doctor hear me?
You're muted, Dr. Stringham.
Yeah, I can hear you.
I have a couple of questions for you that I'm a little confused about. Are we supposed to be 6 feet apart and wearing a mask?
Mr. Chairman, I can answer that question if it would be appropriate.
Yes, go ahead if you feel like answering it.
Okay. What I can tell you is that yes, we should be, and the reason is because all safety strategies really need multiple layers, and just wearing a seatbelt doesn't mean it's okay to drive dangerously. So yes, we should be 6 feet apart and also wearing masks.
All right, one more question. Why is it, I went to the hospital yesterday and they gave me a mask just like the one you're wearing, you two guys. If this is so deadly and spreads so quick, where are the biohazard bins for these masks that people just throw in the parking lot?
Dr. Stringham, for the purpose of the record, Mr. Chairman, shall I answer that too?
Please do.
Okay. You know, I like your question because it presumes that there are viral particles that are left on the mask if that mask has indeed protected a person during that encounter, and that's true. So it's critical that masks be thrown into a biohazard container. And if you're seeing masks that are strewn around and haven't been disposed of properly, then my assumption would be that you're likely seeing the work of people who've been careless. And my opinion is that further supports the need to be safe. So it's critical when we see something that's dangerous to step in and help out. To certainly not touch the mask and make sure that that it's disposed of by somebody who's qualified to do that.
Well, it seemed to me like if we had biohazard bins by the doors, people wouldn't throw them in the street. They'd put them in the biohazard bins.
I agree.
Okay, thank you.
Thank you so much.
Dawn?
Dawn Principe, Sage Hill Arms. So I also feel that the entire letter should be retracted. I do feel that the commissioners as a whole support local businesses. I feel that things that have went on to the public contradict that as far as the way the rodeo was handled, which lost a lot of business, a lot of business for people in town. And also, Dr. Stringham stated in the last meeting that they can only trace 10 cases to small businesses. Huh? Less than 10. Why isn't that put out? Why aren't we telling the public that? I think that we have a very bad case of overstepping power by some members of this board. I think that apologies sometimes aren't enough, especially in this. This is a very emotional subject for everyone. When you tie your emotions to something, it's very difficult. I find it hard to believe that a group of extremely smart people thought it was a good idea to send volunteers into businesses with this being such an emotional subject. That would cause nothing but chaos. Do you agree? So, and I find it hard to believe that nothing was going to be done with the checklist. And several of you stated that it was just to appease the people over you. So you used us to appease your bosses, the higher ups. Does that make sense? I mean, does anybody have a comment? I feel like the small businesses were used. The bigger businesses in town didn't get a letter because we've reached out to them. So who decided who the letters went out to? Was that you, Dave?
Yes. So we had a list that we got from, I believe it was the chamber. And we went through and marked out some of them, for example.
Why would you do that?
Well, Don, we were trying to get the message out.
What message?
That's why you send it.
What message? That's the only letter Sage Hill Arms received ever since it started.
Right. Which tells you we never sent anything out at any point in time because
Nicole Maher said several businesses that through the past year, she just stated you sent several letters to businesses.
we sent several letters out, but I don't recall how many and when and all that.
Why would you select just certain businesses?
I don't know. I can't go back and I'd have to go back and look. I don't know. So
that's not an acceptable answer. You don't get to pick and choose businesses.
You know, it was a list of probably, I don't know, 700 businesses.
Then send 700 letters.
You know, the only ones who didn't were corporate places.
That's crap.
So I'm just saying.
That's crap. But you expect us to believe that you support the small businesses?
Don, I'm not going to let this get out of hand. This is for public comment.
Okay.
It's not for an interrogation.
So why, okay. So let me rephrase this. The COVID task force. I know for a fact, because I've talked to several people who are positive for COVID in this town, the COVID task force is supposed to be calling those people to make sure that they were staying isolated. That's not happening.
COVID task force doesn't do that.
So, or the hospital. It's not happening regardless. So you can trace less than 10 cases to businesses, and we're going to pick and choose what businesses we send letters to, but we're not going to focus on where it's coming from. Any response? Okay. We're still playing an old ad on the radio of how many cases there are and what's going on. Can we update that?
I'm not sure I understand the nature of that question.
So on the radio, it's still the old, I mean, at one point you guys say the cases are going down, but the information to the public says something different.
Are we referring to like KWNA and?
Yeah.
We don't have any control over that. You'd have to talk to them. I don't.
Who get,
We don't
I have
control them.
noticed that they're several days late usually.
Yeah,
several
they
days
can be
back.
behind, but we don't
That's-
control
That's,
that.
that's another business and that's how they run their business. That's not anything to do with the health board.
okay, okay. So are you guys going to issue a letter saying how great the small businesses are doing? I mean, only less than 10 cases? I mean, if you truly support the small businesses in our town, it's time to step up and show that.
Mr. Chair, I forgot to tell everybody, we have copies of the agenda and the response letter, which is, by the way, just a template. But that's what this meeting is for today, is to craft a response to the businesses as to the details behind not only what happened, but how great we think small businesses are. So if you've read that response, that's in there, Don.
We don't need a response to ourselves. We need a response to the public. Thanks for sending us our letter saying we're doing great. We know we are. Tell the public.
Mr. Chairman, this is Dr. Stringham. If I could respond.
Yes, please, Doctor.
Thank you. Dawn, first, thank you for coming in and expressing your concerns. I want to point something out that that I think we're talking the same language, but I just think we're coming at this from two different directions. The reason that I set up the FAST team in the early days was because we were hoping to show where these viral cases were being transmitted. And what we showed was that businesses were absolutely not causing the problem. And in fact, they were part of the solution. And this board devised and recommended that we have that team. And that team has expressly shown that businesses in our county have done a great job. In fact, that data has been used all throughout the state and was part of conversations that occurred between me and the state epidemiologist, indicating prior to the governor's response, initial response back in the early days, that businesses were not part of the problem. So I want you to know that this board, when we say that we have businesses back, we absolutely do, and that's tangible. The other issue is that you'd indicated that you were concerned that we're not really getting that message out. We've been talking about this at board meetings since the very earliest days, and in fact, as I said, we were the very first county to be able to show this, that businesses are not part of the problem. And so I can tell you that we do talk about it. I talk about it a lot on my website, on Facebook, and we talk about it a lot in these meetings, and it's been distributed through the community. One of the difficulties has been getting messages out to people because some people don't read the same messages, but the bottom line is that we have absolutely done those things. And I'd like everybody who's listening to realize that that was the first and most tangible evidence that we absolutely do support businesses here in Humboldt County.
Mr. Chair, I would also add to that, Ms. Principi, is that we fought with the state COVID mitigation team. I mean, time after time, because we kept showing them those statistics in Humboldt County. And we kept telling them there is no need for enforcement. We don't have a problem in the public sector. And they continue to battle and beat up on us. And we finally, again, when we finally said, okay, fine. So we came up with this plan to just tell them, just mellow out. Just leave us alone. That was the whole plan behind it. Nothing more.
So you used us to appease them.
That's absolutely right.
Okay.
I don't think.
That's all we needed to hear.
I think we used the businesses. I read the letter, I read the form, probably a little overdone, but I don't see where that hurt any business financially. If you got that letter and you were worried about an OSHA visit and you went through that, you wouldn't have anything to worry about it. If you wanted to throw that letter in the garbage, you could throw that letter in the garbage.
It doesn't have anything to
don't
do with
see what the
financial.
uproar is.
It has to, that letter had nothing to do with financial. That letter had to do with this board saying that they support small businesses and doing the exact opposite. That's what this letter did. Dave Mendiola just stated that he used us to appease the higher ups. He just said, yes, they did.
I did not. What I said
Yeah,
was I.
yes, yes, he
No, what I
did.
said was I used the letter to appease them.
I said, so you used us to appease
Nope.
the higher ups, and you said, yes,
Not
yes,
at
we
all.
did.
You're not listening to anything I said.
Okay, I'm done.
Thank you, Don. Other public comment?
One more thing, Don Principe, Stage Alarms. If we email him, you don't get your emails. That was stated at the last meeting. So if, for instance, somebody did want to ask about his job, how do we get that on the agenda? Because we'd have to go through him. So do we ask him?
I'm sorry, I didn't catch I didn't understand your question. Say that again, please.
Dave Mendiola is very bad about getting you guys information from the public. He picks and chooses what he wants you to hear.
Don, have you, I just have to respond somewhat to that comment, and I wrote a bunch of notes from what you said. Have you ever looked at the COVID-19 Humboldt County report that's posted?
Gene Hunt emails it, private messages it to me every day.
Now, so after reading those and reading how we report, what our challenges are and what our successes have been, I'm still confused as to why you would say that's 180 degrees out from supporting private businesses, because we have used that data. And by the way, all counties don't do it the same way, by the way.
Right.
All counties don't collect that data in terms of contact tracing and actually spend the time, energy, and money to try to determine where this bug is coming from. But when we were able to compile that data and talk about it internally and whatnot, every single time we had to go in front of the task force for the governor, and it's always the same conversation with them. You have to do these things because this is what Clark County's doing, what Washoe County's doing, what Carson City's doing. You have to do these things because this is the nature of the bug. And every single time we've had to make that argument, we've called on that set of statistics, say, wait a minute, the data doesn't support that in Humboldt County. We do not see the need for increased inspections from OSHA. We don't see the need for placing enforcement officers in the county to try to enforce this thing. What we told them is that leave us alone. We're doing well. We're managing this infection as best we can based on our challenges that are in front of us, but it's not coming from the business side of it. You asked about what would be the outcome of that, or appeasing. I don't like that word because I don't think we appeased anybody. I think we exchanged facts between us. I think ultimately what we needed to be able to do was be able to make our case with the governor's office. And when the stick he had on the other end that we feared, because obviously he's got all the power and we don't.
Right.
The stick he has is total shutdown again, is to completely shut things back down. And he's actually entertained that several times, especially when our case rate went through the roof in October. The problem and what we did, I think, and what the result of the efforts that we have taken on this board was to hold them back, to keep them away from us with regard, even in the light of our infection rate, which, by the way, was the highest per capita in the state of Nevada. We successfully kept them at bay. And I would say that the effort that was shown within that letter was an effort to try to say, they kept coming back on this enforcement side. You guys need to be, if you can't provide enforcement, we'll do it. This was an effort on our part to actually say, because of the infection rate, contact tracing data that we have, we don't feel that what you're proposing is going to be necessary. And what we will do is we will educate folks to make sure that it's consistent across the board, and so that we can, down the road, that we can support the fact that we don't feel if further closures are warranted. That was the motivation behind everybody here, was to protect the businesses. That's why this is so heartfelt on both sides of this table right now, is because the intent, there was never any intent to spank anybody on this. The intent was, as somebody said in here a minute ago, was that we need to link arms and do this as a community, to tackle this thing together. And we felt like we have been doing that all along. And that was the nature of that letter. I agree, reading it from where you were sitting at the time when you opened that envelope, I can understand how you were offended by some part of that. But please understand that the intent of that letter was not to spank anybody. The intent of that letter was to, and use your words, appease the task force on the other end of it to keep them out of our county. Because frankly, it's pretty frightening to see what they had in mind with regard to, because we kept them at bay very easily back in June and July when our case rates were way low. We were some of the lowest in the state. But when things happened in October and we lost, it started to look like we were losing control of it. They immediately jumped on us. They immediately came at us in terms of what they were going to do for us. And I think, and it's to the, I'm just gonna sing the praises of this board and some of the other members on this board, is we successfully kept them in Carson City so far. We have. Talk to your folks in Carson City. Talk to your people in Clark County, people that you know, that gun shops or anything that you know have businesses in those areas, and ask them about what they're dealing with in terms of regulatory overreach, as you pointed. I think we've done a job that we were proud of up to this point, of trying to mitigate the disease, minimize the exposure potential for people who were afraid and did not want to be exposed to this thing, and at the same time try to keep our businesses whole in this county. And that's a tough wire or a tough fence to walk down the top of.
Well, we can't walk the fence. Don't send us any more letters.
Well, what I mean by the fence is that, Don, you're sitting on this side of the fence. I'm standing on top of this fence. And on this side of the fence, we've got people in this community who contact us on a daily basis who are afraid still.
And I get that. Then we're not communicating to them.
So what our management and our decisions are trying to manage that perception on both sides of that fence, to people feel safe to be able to do business in our community, to be able to embrace the relationships that we've all had with, whether it be from gyms or whether it be from gun shops or whether it be from whatever. And at the same time, hopefully put this together, put a policy in place to keep the state from sitting on our doorstep on this thing. And secondly, to try to do the best we can to make sure our businesses stay at least whole, to where when the bell does ring, they can take off again.
But do you see how the letter contradicts?
I'm sorry?
Do you understand how that letter contradicts everything that you're trying to?
I don't think it contradicts everything, but I do think that parts of it, there's 2 paragraphs I wouldn't have written in it. And I think that definitely should have been there. But if you look at it from a standpoint of what we're trying to do in terms of making it holistically across the board, trying to make sure everybody kind of sees this challenge the same way, and that was what the point was. So when Caleb Cage comes back to us from the state task force and says, what are you doing for enforcement? We say, listen, we have a survey out there on the ground that actually gives the information that folks need in their businesses and whatnot, and we have compliance across the board in our community. And oh, by the way, we can't trace our cases back to the business community, and that's compelling. I mean, they can't come back and say, right, hey, well, that's your opinion. We have the statistics to back it up, and they have been sitting in Carson City as a result of that.
I'm JC Jackson with Bacara. I'm sitting back and listening. I really wanted to see both sides of it, because I want a resolution to this for everybody. And what I'm hearing and what I'm seeing, and maybe I'm wrong, and I'm not trying to speak for everybody, but just for myself, is that I see a lack of communication. And maybe it's a communication barrier. And it's just on the fact that what we hear on the radio or what we see on Facebook is not what you just said today. And
No,
that put a lot of things in perspective for me.
It's in this report.
Right. But I think it's one of those things as we're reporting things out, let's do report the positive. Let's do show the fight that you're fighting for us, because we don't see that. We
I don't
hear
disagree.
that.
I don't disagree that,
And I think that's
that
something
some
that
of
we
our
need to
reports
hear.
should probably start with the positive and end with the positive.
Right.
And I
That'd be
wrote that down as
awesome.
well
Right.
because
And I think that's
I think-
part of the problem here is that we're only feeling the negative coming in on us.
I don't disagree that, and in fact, we've all had that conversation internally recently where we felt like, and what you do is you get into this mindset that, my God, we got 7 more cases today. Looks like
Right.
we've had 1 more death.
Right.
I'm not minimizing that. I mean, every one of those people are real people and they're
Exactly.
friends and family
We have
and
family that have
grandparents.
died from the COVID.
And so I'm not minimizing any of that. It's a big deal.
Right.
I think what happens is you get into this mindset where it's almost like a baseball score. You're getting these statistics on a daily basis and they don't really have a meaning to them. And I would like to see us be able to identify the fact that we are still seeing, yes, we had 7 new cases yesterday, but it appears that from contact tracing, it appears that it's coming from family units. Please be careful with the Super Bowl parties and all that kind of stuff. But it doesn't appear to be coming from our businesses at this
Right.
point, according to contact tracing. And I think we can probably sing those praises, and I think we should.
Right.
Yes.
And I took those notes, and we're gonna have that conversation internally here. And I get what you're saying on that. I agree with that. But I think it's important for us to, with the folks that are sitting in here right now, everybody has, it's been mostly from the negative side of what that letter meant and criticism, which is fine. We signed up for that. But I took, when it hit the fan, so to speak, when the letter went out and whatnot, as you might gather, every one of us, the phone started ringing. People started grabbing me at Walmart. I was down getting a COVID-19 shot at the fairgrounds, and I got hit by 3 people walking inside there, but not hit me. They came up and grabbed a hold of my shirt and wanted to talk to me about it. So I started keeping track of my phone calls. I started keeping track of my texts and people trying to communicate with us, and over 40% of them were people from the other side of that fence. I can't tell you how many of them said, hallelujah, go for it, honestly.
Were they business owners?
No, there were people from our community that were glad that the letter went out.
Yeah, because they
because they're
think
not
we're to
business
blame,
owners.
because they think we're to blame.
Yeah, because they're
No,
blaming.
it wasn't about blame. That what they wanted to see was consistency on it, because some of them were still very concerned, and mostly, I'll grant you, most of them are folks that are 60 or 65 years old, and but they're members of our community, and they were encouraging us to continue a policy which protected them. And that was their side of the fence, is what I'm trying to say to you. It wasn't from the business community side of the fence. It was from the folks who live in this community or right alongside of us. So I think that's important that all of us, including this board, including everybody out here, understand that is that there's a lot of anxiety out there on the ground. I know that I've heard it today that I heard the word fear mongering and all that kind of work. The sad part of this whole thing is that every one of us has a set of stories that we can share, and there's some truth in all of that. But the truth is that there's 500,000 people that have died in this country from it since about March of last year. That's the truth. But we can debate how many of them died from something else. But it's really perception's reality to the people on the ground out there. And
But how many people die from pneumonia and the flu every year?
Well, you can't minimize the guy that died from COVID-19, though.
I'm not trying to minimize it.
Yeah.
I'm just saying
But
that
by
there-
saying-
or cancer. I mean, it's the same thing.
I understand that, but we have to understand that that COVID-19 is real. COVID-19 has made some people in this community extremely ill and has killed some of our members in our
Yes,
in our
it has. And
our
I'm not
community.
taking away.
No
from
doubt
it,
about
never.
it. Okay, so I think ultimately knowing that's the bottom line here, the perception of it. from a business community, it would be in everybody's best interest to know that we're standardizing how we're dealing with the infection spread of this thing. We're standardizing it. And at the other side of it, that the public gets this perception that we're on top of this, that we're trying to do the right thing with regard to getting it in our rearview mirror. And by the way, if you look at the statistics that are coming out of January, and it looked like, looking at all the statistics from our wastewater treatment data that was out there on the ground, that we were in for a real tough January and February. It looked like, based on the viral counts we were seeing, and we had some estimates that were pretty scary. The truth is that it's behind us. It seems to be behind us right now.
But what I'd like to see is this, sorry to interrupt you. What I'd like to see is the statistics from the amount of people that were getting tested in the beginning to the amount of people that are getting tested now. That to me is different.
The infection rate, you're saying?
Yes.
That is actually part of the report, is the
So-
infection rate.
But how many people were getting tested because they say our rates went up, but how many people were actually getting tested in the beginning? So were there 100 people that got tested?
Well, they
Or
don't
were
do it
there
by the-
thousands? And now there's thousands of people that are getting tested? That's my question. Is that why our rates went
And I
up?
think that's why they report it as a ratio. It's cases, positivity cases, and it's based on, okay, if you've got a basket full of people that were tested for either sick or through employment or whatever, they had this many people that were tested, and the positivity rate from that group of people right there was this number. That is the way the state's been actually handling that statistic, because it's exactly what you're saying. You can wash that out either direction based
Right.
on just trying to say everybody got tested or nobody got tested.
Right.
So I'm not going to sit here and tell you that I think the state's I'm 100% behind what the state has done. I'm not. We fight with them all the time on this thing. We came to this table and we're volunteering to do this work because we
I
felt.
commend you for that.
Well, thanks. But it is a thankless job.
Right.
But we're neighbors. We're friends. We know each other in this community. Our kids go to school together and whatnot, and I think it's across the board. It's our interest to make sure that two things, that we don't infect people. We don't have a huge number get away from us in terms of infection rate. And boy, if you don't think that's not the case, ask those guys in Elko County right now. And sometime we'll talk about how their mistake, but we were trying to protect the community. And secondly, at the same time, though, we recognize that what was going on with the smaller businesses and whatnot this was apocalyptic, and we had to do something. And that was from a contact tracing perspective, that was the reason we were collecting that data from the business side of it. It's worked, and I think it will continue to work. And I think ultimately what we're trying to do here today, though, is that how do you help us with our challenge of keeping CISILAC from putting a bunch of people in this county as enforcement officers on one side, and then secondly, how do we put this in our rearview mirror, period, get it out of our hair? And we were, as you probably gathered on our county commission meeting when you guys were in there before, we were taking notes trying to figure out how do we put teeth in a resolution? How do we make this resolution relevant? Back to the, so he doesn't line his bird cage with it. Trust me, we don't take the time to write this thing unless it means something either. So what we're trying to be, we're on the same side here. And what we're trying to do is we're trying to figure out how to make this right. And what we're asking for is, the first thing you got was an apology for a couple of paragraphs that were probably taken wrong. I'm not gonna candy coat that. But on the other side of it, trying to go to 30,000 feet. So how do we link our arms to make ourselves better at resisting what's going on in Carson
And I think
City?
that's the communication, is letting us
That's
know
where the
that you're fighting the
communication
fight.
comes in.
Aside from what we're doing here on our Facebook page and our COVID-19 task force,
If you can send a letter with a checklist in it, send us a letter.
Or just put it out in the public.
So if a checklist, if it's nothing more than hey, if OSHA comes into your front door, this is the things you probably ought to be thinking about, because they're going to be thinking about it. That's really what the idea was on behind it.
Well, I think after seeing what OSHA did this week, I think it's pretty sneaky what they're doing, quite honestly.
Yeah.
They were up at Uptown Market taking pictures and queries, but Jane and Hobart called me Like, are you going to the meeting? I can't believe they're standing out here in front of my business taking pictures of our business. Apparently, they don't know Hobart Studebaker very well because they're lucky. But I mean, that's crazy. You didn't, I mean, no one's going in and going, hi, I'm OSHA, you know, da 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 da, let me help you. I mean, then don't come here.
Yeah.
You're just causing
And none of us
problems by
support
doing that and causing fear.
And
And
they
that's
don't tell us
something.
either, by the way. We
Right.
don't know any more about it. either.
But I mean, I guess, and I think that's the whole point of the letter that was terrifying is, are we going to have that? But now they think they can come into our business and, you know, take pictures and monitor who's wearing masks and who's not wearing. And I'll tell you, I do wear a mask often because of my mother, but I don't. It's hard for me. I have an autoimmune disease. Wearing a mask all day is killing me, I feel like.
I
It's
agree.
so, I'm so tired. I'm exhausted all the time. And it's just walking up those stairs with the mask on. And I wear it in because they asked me to coming in the court. But I do it and I am drained by the time I get up to the stairs. I feel like I'm 90 years old. That's not a bad thing. But I mean, to me, being,
I just did that.
yeah, it's exhausting. And so I think we're just to that point. But I think it's just the communication.
I want to ask.
We're hoping that.
Excuse me, Commissioner Cherry, you have something you want?
Yeah, I'm a member of the Chamber of Commerce, so I got the letter. I did not take it like you folks did. Well, because I sit on this board and I knew why we sent it out. It was because we didn't want, if you go back to when COVID started, the governor shut down what he called non-essential businesses, and he was threatening it again. We in these meetings, just like this, said, what can we do to satisfy him? And you can call it whatever you want, but we had to satisfy the state, okay?
Right.
From keeping so that we can keep what he calls non-essential businesses over. We can go and we can help our small businesses to meet his mandates by just walking in and say, hey, if you might think about this. If OSHA walks in your business, you know, you've got some people in here with masks on, you're probably going to get a citation. We weren't going to enforce it. We were trying to help small businesses in case OSHA showed up that you would not get a fine. We don't want to see your businesses slow down. Why would we? You know? So that's what, if that last page had not been titled the way it was, that had it been titled like, this is a checklist to help you, I don't know what the wording was. And we're offering you PPEs, sanitizer, all this, what we can do to help you. Would you be here today had that letter been titled a little different on the top?
Well, if it would have been, yeah,
it would have
the
been
whole
listed.
thing would have been written different and the
It wasn't
form was
in
not
there.
with it, then
I know.
most likely.
So it wasn't really a bad thing. It was titled wrong.
But I think you just shed some light on something that just made sense to me, is you just said that you're the Chamber of Commerce and you got the letter. My businesses are not. I did not receive the letter, but I received the letter from others. And so I'm wondering if did the letters go out because of a Chamber of Commerce list? Is that what happened?
Yeah, that's what we used, was a Chamber of Commerce.
So that's why, because I know several friends of mine who have big businesses in this town that have been in this community for a very long time that did not receive the letter. And because that's why some were sent out. Thank you.
You're absolutely right.
No doubt.
Target certain businesses, maybe you send a letter first and say, hey, we're going to send this out.
That's a good idea.
That's a great.
Yeah, that's a great idea.
So if you
Great
wanted to
point.
send out a letter that
The other
you
thing
send a
is-
free letter out saying, you know, you will be receiving a letter at some point in the future. Don't be alarmed, you're going to be getting it. Then you could send out so many letters every week, you wouldn't have to send out a mass mail.
Right.
Can I
But then
interrupt
not
for a
go by the
second?
Chamber's list, because not everybody is part of the
Yeah.
chamber.
Chamber list might be a
You're right.
good one to start with, but there's other lists that
And
could
we're,
Well,
be used
yeah.
as
what do we
well.
start to?
You're right.
No, I didn't. Well, I did.
Yeah.
Why did you get it and I didn't?
And I think some people felt it was personal.
This
when they
Commissioner
got it.
Hill, can I step in?
Yes.
I just have a suggestion that maybe we go to our master list through the county and figure out who has purchased city and county business licenses and go off of our master list versus we'll call the chamber a third party at this point. Not everybody belongs to the chamber, but everybody that is legally bought a business license or a city license is going to be registered in this courtwenty.
Yes.
Yes.
That's a good idea
Thanks.
too,
Yeah,
Commissioner
I
Hill.
agree.
I think we need to get back.
Wendy, you want-
I do, sorry.
Thank you.
I didn't want to
Commissioner
interrupt any of
Tipton.
you. Wendy Maddox, for purposes of the record. I want to point out a couple of things. Your idea that licenses, we need to put that on a future agenda because I want members of the public to know what you guys are doing and have the opportunity to be heard. So we need to make it an action item on a future agenda instead of just internal discussion. And I just want to point out to everybody that I heard something about maybe internal discussion amongst the board. And I want to make sure that everybody is aware that NRS 241 prevents you all from having any kind of serial communication unless there's an exception. So if you want to reach out to me and say, can we, is this an exception that I can talk about? Please reach out to me first. Otherwise, the very best idea is if you want to talk about something, let's put it on a future agenda, not have internal communications, and it will be properly agendized and the public will have the opportunity to know about it and be heard on the issue.
Thank you, Wendy. Commissioner Friend?
I just one last suggestion for you guys leave. I think, we modified our agendas for the health board meeting to include reports from the hospital and from the school district. We're getting almost each time we meet now, we get or you see on this agenda, we get that lined out. And I'm wondering if we shouldn't have a representative from the business community that actually is agendized as well, so we can actually talk about what's going well, what's not going well, how can we facilitate, what your challenges are, and secondly, we can pass along to you the concerns we're hearing from the other side of the non-business community in there.
Well, I think it would be
I
a
think
good choice.
just talking about having transparency and whatnot, I think that might be a real good way of us having that conversation legally with the open meeting law. But it also gives, because we're on a streamed meeting, we can the general public can hear what you guys have to say.
Plus, it helps us communicate with each other from you.
Right.
Because what you said today was empowering.
Yeah.
And what you said about holding back Carson and the governor, we've not heard that. Those words we've not heard before, in a sense, as strongly and as powerful as you said it today. And that resonated with me. And that's why I came up here a second time. And I want to thank you for that. I want to thank all of you today. Thank you.
Well, I think ultimately my goal in a meeting like this today and the one that we had on Monday is that we put our differences aside, we understand them, and whatnot, and then we take a bad situation or a tough situation and we turn it into something positive. And I think we can do that with that communication side of it for sure.
Great. Thank you, gentlemen.
Commissioner Tipton?
I want to say one more thing.
Commissioner Cherry, go ahead.
I was the chair at the last meeting and it was a tough meeting, but I understood walking away why everybody is frustrated today. Way the election went nationally with COVID coming on a year now. There are people frustrated. They needed to cut loose. And we were happy to be that for you the other day. But please just understand that we are working for you, with you, and anything that we're doing wrong, do you feel we're doing wrong? Please tell us. But maybe, I've heard it a couple of times here, communication. So we'll try to do a better job with that. And if you have any questions, contact one of us.
Appreciate that. I just have a quick
Go ahead, Jill.
addition. Talking about communicating and what we can do to help you guys. I want to reiterate what Johnny Rant had said. I believe that when we're reading all of the reports of COVID and who's got it and who's positive, all that, it's all turned into a bunch of nothing. It's all the same report. Nothing really changes other than, somebody in their 60s has it. We could be very basic. We just need the actual information straight up. And if you put it in the newspaper, it's all part of the communication like we've been talking about. But I mean, honestly, you can do a small form. It's got the number of total cases, number of deaths, ages of the deaths, the number of cases being traced. That's straightforward. It's communicating with the public. And I think that's going to alleviate a lot of the fear that citizens have. If they can understand it completely, they're going to feel more comfortable going to the businesses, and the businesses aren't going to feel like they're being attacked and being held down, because that letter, it did feel like an attack. It felt like we were going to have our citizens spying on each other. That's not what we need to do here. We need to get the correct information out, make sure everybody understands what they're reading, and everybody will work together. We have a great group of people in this whole community, and all the business owners, we're all socially responsible. We understand that this is real and what needs to be done to keep our numbers down. You guys have to give us a chance to be able to show that, and obviously the numbers are proving that we're doing things right. But be transparent, you know, enough with all the extra garbage. And the other thing, I have a question. When do you take people off the active list? How do we know that those numbers are accurate? I think people have doubt in the numbers being accurate because, you know, they don't actually change other than to get worse, but yet we're hearing that things are getting better and nothing is reflecting correctly. So when someone has had COVID and they no longer are quarantined and they no longer have symptoms, is that when you take them off? Who's following up with that? You know, I think that we need to work on doing some better tracking maybe at the end of it to make sure that we're updating numbers.
That actually was, that conversation was, we had that, actually had that several times. What is the criteria?
Right.
When does somebody come off the active case
Right.
list? Do we, you know, there was a standard, CDC standard in terms of how many times they had to be tested negative and that type of thing. And we don't follow that even now.
Right.
But the bottom line is that it's not an exact science, I guess is what I would say to you. There's people who are no longer symptomatic, but maybe testing positive still. Those are the kind of challenges you have. But suffice to say, when somebody is no longer active in terms of the active symptoms of the disease and whatnot, they pretty much come off. The other thing, would you like us to report on the hospitalizations? How many people are in the hospital with
Yes.
COVID-19?
Yes, we want to know how many deaths. We want to know how many people are actually recovered. We want to know just the straight up facts. And
Because that is something, some of the things that we talk about in these health board meetings, and some of the, in fact, if you listen to Nicole's report many times, she'll actually give us a heads up in terms of, is the hospital filling up? Is with people with COVID-19? Are we at a critical point? What are the hospitals that are in our neighborhood? You know, what is Boise's doing? There was a period of time in December, not only were we filling up and we had Rampart, the tent hospital built up in the basement, but we were told that they weren't accepting patients at Renown. They weren't accepting patients in Boise or Salt Lake City because they had their own challenges. And so those are the kind of things that we were trying to get our arms around.
but on the other side of the coin, you know, I think that the numbers aren't accurate, and I think that people aren't believing all of that anymore, because when you know people personally that have had it and the testing isn't correct, I mean, you know, people are getting tested twice. Once it's positive, once it's negative. Somebody had a test, the other person didn't have that test, and then somebody had this test and they were both positive. How many of those tests are, you know, being counted as a positive? I mean, these are the things that have gone on, and the numbers are not correct. So who's monitoring and who's tracking? You know, I think that the concentration needs to be more on that type of thing, and not going after the businesses. The businesses they're not the problem. But all these people that have been tested, if they're sick, you know, and you know that they've tested positive, track them at home, make sure that they're doing the socially responsible thing. Let the public know that people are being tracked and people are staying home. People are smart. We know it's real. People do the right thing. But I think that when the community doesn't know what's happening, they don't know the true numbers, everybody's scared. And that's why we're still having issues with the public being scared. I think that the transparency needs to be there.
Commissioner Tipton, I'd
Thank
like to
you.
be heard, please.
Yes. Go ahead.
I have one question for you before you sit down, please. How do you get your information?
Well, I talk to people, I ask.
No. How do you get your information that you would consider it to be correct? Not that, I mean, we all talk with each other over this.
Well, there again, you could put it in the
No.
newspaper.
Not that we can do. How do you get it at this point in time?
I guess I don't understand what you're saying. We
How are
get it
you
from
get-
Facebook, we get it from,
Okay.
talking to people,
So you're not getting an official report from Nicole Maher?
Well, we're getting a official report from Gene Hunt, who seems to be official enough, and we get it on there, but that's the thing, we don't put it in the newspaper. Not everybody sees it on Facebook. Not everybody knows to get a report from.
That's what I want to hear from you.
We need just put that little form. It's this big. It doesn't take much to just get straight to the answers. Put it in the newspaper, run it in there, put it on Facebook, make that the official, people can actually see it and read it and
Okay,
understand it.
that's a great suggestion. We don't know what's happening out there in the community a lot of times.
People are confused and there's.
And
that
well,
lack
I
of
know that. Can I
communication.
speak, please?
Sure.
Okay. You've all showed up today for a reason, and I'm proud of you. Okay. We haven't been able to keep that contact with the public because of the COVID restrictions. So we are, as a board, trying to get everything out to you guys, and we don't have any input from you on whether it's getting here or not. I've seen the same things you have. So I do want to reiterate, we went over the last board meeting. Okay, this board has been fighting very hard for the public, believe me. And I'm new on the board, but I have watched them for over a year, and the board is doing what they possibly can. Now, what happened on that letter, it went out on its own. The board didn't have anything to do with it. At least I didn't have anything to do with it. I didn't know anything
That's
about
not
it.
entirely true. I know you two didn't.
Well, public comment, you got something to comment on there?
Well, I know that it didn't go out on its own. Somebody absolutely issued it, which was,
Not a board member, though, is what I'm saying.
well, that's what we're trying to get to the bottom of. Who issued the letter, who thought it was a great idea, and who made that mistake that it shouldn't have been sent out. It didn't just automatically get sent out. It
Dave,
got sent out by someone.
Would you care to answer on it?
Mr. Chair, Dave Mendiola. I have, the first meeting was the health board meeting last week, and I apologized for that.
Right,
I have
right.
taken responsibility. I don't know what more you want. I mean,
I'm not saying, he's just asking me where.
I
Okay.
take responsibility.
Now, I didn't ask that question to start an argument, because at the last board meeting, he did apologize for it.
Right. And
I just want,
I
from
heard
what,
that, and I appreciate that.
from what Commissioner French just said, and he was telling you what the board has been doing over a long period of time to help the public.
Okay.
And I just want to make sure that you're not walking out of here with a different story in your mind, thinking that the commissioners had anything to do with it.
I'm not sitting up here and attacking or saying anything. I'm trying to make suggestions. You guys asked for suggestions. You asked what our thoughts were to make it better. My suggestion is better communication. Put it in the newspaper, get straight to the point, do better on your tracking. That's all I'm saying.
Thank
I'm
you.
not pointing fingers. I'm
No,
strictly
that's what
saying
we're asking for. And that's all
that
we're asking.
better communication needs to be, and there needs to be more transparency. People will not be as afraid if they know what's going on. And if it's out there and the information is straight to the point where in layman's terms, people can understand it, that's going to help.
So
And
what I-
that's all my thoughts are. I'm not attacking anyone today. I have nothing.
No, nobody said you were
Bad to say.
attacking anything.
And I appreciate the fact that you guys are taking the time to skull cramp with us in terms of trying to figure out how to get this message out. You use the word transparency, and it infers that there's a cloak over this, and we're not, and we're.
Well, and it may
picking
not
and
be,
choosing
it may
what
not
we're
be
saying.
on purpose.
No, and the thing is that I believe transparency is on everybody's frontal lobe. Nobody wants to do this in a back room. The bottom line is I think what we can improve on, and I hope to get more suggestions on, is where does the message get posted? What do you want to see in this message? What you're saying is that we don't want to see a lot of we don't want a long-winded report. We just want, give us the facts.
No.
And sometimes the facts are important, though it's important for us to explain what they mean and where they came from, and you'll get that. But from the standpoint of how do we get this message to you, I would say, the newspaper is in these meetings absolutely every time. We've got a reporter, I'll bet you, on there right now. So the newspaper has access to this information. They hear the same thing we hear. what they print is their call. But I would say that it's important for us to be, if we can put it, I know we put it on our Facebook page. We put it on the health board, our
County page.
But a lot of folks in this, that they don't have Facebook or
Yeah.
they don't
So
have
that's just-
internet, maybe old school people don't do that. And so therefore you
we-
need to have something that's official, not what the
So
paper
aside
has
from the news-
decided is official, but official something, straight to the point, put it in the newspaper. You know, there's different means, different ways that you can do it, but I think that by getting it out there that way, more people and a lot of the older folks that don't have Facebook, don't have social media, they're going to be able to see it, and the fear is going to be less because it's straightforward. They can understand it. We don't need a big long column of this one, and it was due to a friendship over here. We don't need all that. Just get straight to the point. How many people are there? How many people are sick? What are the ages? Did they have underlying health issues?
I'm questioning, do we need to do it as much as we do? Does it have to go out every time 2 people test positive or 5 people test positive?
Make
Would
it
once
a week,
be
weekly
enough?
or something. You know, I guess it doesn't necessarily need to be daily, but make it a weekly and then make sure that it's accurate. You know, that's, if the numbers aren't correct because you guys can't get the testing, not you guys, but I'm saying as a whole, when you're testing and you're doing all these, tests haven't been accurate. Numbers aren't accurate. So how do we concentrate on getting that end fixed so that we get correct numbers out and the community knows what's going on? That's, you know, I
When
think
you
that there's,
figure that one out, we're going to need to publish that nationally because they're having trouble
Well,
in every state. But
I agree, but I think that it's a good start
I
to
think ultimately, all
put
of
it
us-
in the
All of
newspaper.
us have your same concerns along that line, wondering about whether, we've all had stories about people who didn't test but got a positive result. We've heard all of that. One of the things I think I do is I try to look at it from kind of a holistic view. Is I don't try to, if the report I got this morning says there's 5 new cases or 7 new cases, that fits in a longer, it fits with the information that we're seeing right now in terms of a decline in numbers. So what I'm looking for is that if all of a sudden, like we had happen in October, when you get the call and it says there was 125 new cases last week, and it just goes boom right through the roof, then you know it might have been 123 or it might have been 137. We don't know for sure, but one
Or it
thing
might
we
have
do
been
know is
10. We don't know.
statistically, we know that it's going through the roof, and we're trying to figure out where it's coming from. That's, I think, ultimately what we have to. I'm just speaking about how I'm looking at this data as well, because it's a national issue in terms of some people are, some agencies and groups are very, very fastidious about how they report and how they test, but and some aren't.
Right.
So, and then the other thing we're finding is a lag time with the state testing side of it. When you send them into them, sometimes it's 6-7 days before you get that data back. But I think ultimately, one of the things that I have thought has been really helpful that we're seeing in these health board meetings, and I would recommend that you weigh in on those or at least get them, they're uploaded to YouTube now. I think one of the things that would really be that's helpful for me is the data that is being collected through wastewater, because that's not about somebody going in sick or somebody's in the hospital or somebody died from something. It is about how much viral RNA is there are they finding in the wastewater viral RNA, and so. And then if you can say, my God, it was up here in November, but it's down here in January, and it's continuing to go down every month, that's telling me the infection rate is dropping off in our community. And I think that's a real good piece of information that you ought to try to track.
This Commissioner Hill, I'd like to call a point of order to the chairman. Although this is good back and forth conversation, I think we're getting way off of the agenda.
I agree, Commissioner Hill. I would like, unless there's some other public comment that hasn't been raised, I'd like to move on to our agenda item.
Mr. Chair, before we go on, I'd just like to make it couple of comments. I would encourage everybody to listen to the recordings of the health board meetings from the day we started on, I think it was April 23rd, I believe. The things that we were just talking about here, about how do we get the message out, we talk about it every single week in those meetings, pretty much. I mean, we may miss a week here or there, especially over the last 2 months. That has been the focus. How do we get messages to the elderly who don't use computers? How do we get the message to people who only read the newspaper? And it only comes out once a week type thing, you know? Super challenges, and we've talked about it constantly, so we're always trying to figure out how to do it. So just to your comment there, boy, if you, and Mr. French, you're right. If you got an idea, please send them to me. We're looking for help. We're not sure how to do it. We're flying by the seat of our pants most of the time. So let me just say that. The other thing I'd like to say is that there's been a couple of comments today that you'd like to see the board rescind the letter and the checklist. And that has already happened. Last Thursday in this very meeting, this board took action on that, and they rescinded the letter, and they also abandoned the checklist. So that's over. That program is done.
Good.
And I don't know if you saw that, but that program is done. It was in the newspaper today again in Ashley Madden's article. But one thing I'd like to do is I'd like to congratulate you folks. In my mind, one of the biggest problems, and we're hearing it today about government, they don't listen, they don't respond. And we sent something out and you responded. And guess what? A week later, they rescinded it. That's government working. And you should pat yourselves on the back. That's the way it's supposed to be. We make mistakes. And when we do, you need to tell us about it. And you did. And so guess what? This board rescinded those things. And to me, I'm proud of that. You know what? I'm not perfect. And what these guys did was in line with what you wanted. And so to me, I just think this is government working. This is the way it ought to be. And it's only going to happen in communities like this because it's at the larger level, it's a disaster.
It is.
My comments.
It is.
Thank you. Do you have something we have?
Yeah, I just wanted to make a quick, because Mr. French, Commissioner French, you said something earlier about some older people that were, this large percentage of older people that were scared. I have no doubt there probably is, due to the fact that there has been so much, in my opinion, fear-mongering put in with this, okay? Back before they ever knew about COVID, before it ever came out, and now mind you, I've had pneumonia multiple times. I've had personal number of times. I've had bronchitis a number of times. I've got an autoimmune disease. I've had a heart attack, okay? I'm living with AFib, okay? I've got a lot of medical problems. I've had mumps on both sides till I out here like a monkey twice in my life. You're only supposed to get it once, but like the doctor told me back then, oh, every once in 10, 15,000 people, there's a weirdo. You just happen to be one of them. That's exactly what he told me. Okay, I accept that. I've had all these things. I am high risk. I am over 66 years old. Okay? Back before they ever knew what this stuff was, I came down sicker than a dog. I literally collapsed when I stepped out of my truck and crawled up my house steps into my house. I would not let my granddaughter come and get me to bring me to the hospital because I knew whatever I had was nothing like any of the rest of the stuff I'd ever dealt with. Okay? I knew it was something really bad. And I was scared that she would get it or she'd take it home to my great-grandbabies. Well then, when all the deal came out, and I started running a high fever. And for almost a week, 6.5 days, I ran a temperature between 103.4 and 104.4. And I thought, well, if it reaches 104.5, I'll call an ambulance. Because I literally could not stand up. I was crawling. My neighbor came over to do my chores. I wouldn't let him bring the eggs in the house. I said, I don't care if you throw them away, but do not come in my house. Whatever I've got is bad. Finally, I got enough strength to get to my truck, to drive myself to the walk-in clinic. I weren't about to go to the ER because that's another story, but to the walk-in clinic, put a mask on because I don't wear a mask because I can't breathe with one on. I literally start gasping for air. I have to get it off my face because I can't breathe with one. I went to the walk-in clinic. First thing I walked in the door, I grabbed a mask and put it on because I knew whatever I had was bad. When I went in, they says, well, you got an upper respiratory infection. And by the way, I was still running a temperature of 104 that day and gasping for air. I was sent back home. Well, he did give me a prescription for a heavy-duty antibiotic. He says, you got a respiratory infection. I says, I've had respiratory infections before. This isn't right. He goes, no, it's a severe one. And I said, okay. So then when I went to pick up my prescription, I put on my mask to go in and get it because I knew whatever I had was bad. And I didn't want to give it to anybody. I didn't need anybody to tell me to keep not spread it around. It was obviously bad. And my granddaughter says, Grandma, let me take you to the hospital. I says, no. She says, well, I'm scared you're going to die. I says, I don't know if I'm going to die or not, but I'm not going to let you come around me because it's bad.
Excuse me, Ella.
No, the whole point in this is I actually went to Dr. Strigham's office after I found out about the COVID and the fact that the antibodies from people's blood that have had it can help people. Because when it first came out, I took it very serious, okay? And asked for him to call me and told him to, you know, so I could be tested to make sure if I did or didn't have it. And I never once got a call back. Not only was I very sure I'd had it because all the symptoms I had, but I also am O negative, which makes me a national donor. Never got one call back. And right there told me something's not right. Why would not, when they or somebody gives them an opportunity to help people, would they not even bother to return the call? And I went to his office and left my name and number. So I don't buy into the, yes, it's bad if you get it, because I really thought I was going to die. But you know what? Running around scared, being terrified to live is not living. And we need to stop. We need to be honest with people. We need to be considerate when people are sick. You need to use your common sense and stay away from other people. But to go around being afraid all the time is not living. It's not living.
Thank you. Okay, if you have any other public comment, we'll have that at the end of the meeting as well. We'll go to approval of a response to business educator letter. Consideration, discussion, and possible approval of a response, including the specific language to be crafted to criticism by local business owners and citizens regarding a letter that was sent out by the county manager's office to re-engage the business educator program that was established early in the COVID-19 response to assist business owners with setting up protocols for managing the spread of the virus while staying open. The board will also consider the options available to disseminate the message, including but not limited to the press releases, social media site, radio, and newspapers, discussion, and possible action.
Mr. Chair, would you like me to handle that?
Yes, please.
So what came out of the board meeting from last week was obviously, as I mentioned, this board rescinded the letter and the checklist. And then there was talk about having a response to the community. And I think one of the individuals said it was to the businesses. It was to the community. That was the idea behind it, including business owners. And so you wanted me to bring this back and put out some kind of a response. So what we put on the agenda was a template. It's not set in stone. It was just some ideas to consider. And so that's what the purpose of this agenda item was, to do whatever you would like to do with it. Make some modifications to it, completely rewrite it, or don't do anything. So that's the goal here behind this was from, again, the board wanting to consider, as you recall, we were wanting to have a response as quickly as possible, but due to open meeting law, we needed to bring it back at a special meeting, which is why we're here today. So that's where I would start it, is that if you've read the letter, maybe we can just start with some comments about its contents and go from there.
Commissioner Hill?
Yeah, this is Commissioner Hill for the record. So one question I need clarified. I guess I was under the understanding in the last meeting that we had motioned and approved to have you put something together and have it reviewed before any communication was put out to the public. Is that correct, Wendy?
So, and I don't know if the clerk can tell me what the exact motion was. It's Wendy Maddox, purposes of the record. I recall at the last health board meeting that there was a motion made in regards to the letter and removing certain things, including people going into businesses and the checklist as part of that letter. And I believe at that meeting, there was some discussion about a reply. If there was going to be one at all, it was our recommendation of the DA's office that if there was going to be a response, that it come before the board at a properly agendized meeting, which is why we're here today.
Okay, so that was my understanding. So the night after that letter, a response came out by, I believe it was Nicole Maher, released a response to that, basically telling what had happened in the meeting. I kind of feel that maybe went against what we were deciding to do before we communicated. Anyway, I just wanted to bring that forward, that I kind of thought that went against what we had decided in that meeting.
Well, Mr. Chair, so I'll respond to Commissioner Hill. No, I mean, all that we did that was a press release, just announcing the fact, we were just trying to get the information out that you had in fact taken action on that letter. You rescinded the letter and the checklist. And that was just, we wanted to get that word out so people would know that the fact they were upset about it was taken care of. You guys had come back, taken action, and that was the whole purpose of that. It was just reporting what had already taken place, what was already approved. So that's not something that would have had to come back before the board again, because it actually took place and you approved it. So it was part of the action that you took. And that's all that was. It was just informing what happened in the meeting.
Okay. Yeah.
And Commissioner Hill, also in regards to your question, in an email that I sent all of you, I really want at the next health board agenda, Wendy Maddox, purposes of the record, if I didn't say that, I really want direction from this board as to, there was 3 members on this health board, or I'm sorry, 5 members that are on this health board. 3 of the commissioners that are here today, and Sheriff Allen and Charles Stringham, that approved press releases going out in the manner they've been going out. Now that there's 2 members to the board, I think it would be important at a future agenda that you take some action to give us some direction. What kind of press releases you want us to send out? Do you want it to be limited to just COVID deaths and the form we got earlier? Do you want it to be whatever the scope you want it to be? I think it's important that we get some direction from you.
Okay. That's all I have.
Thank you. Commissioner Haas?
This is Commissioner Haas. It was my impression after that last meeting that what was asked of the board at that time is how many people thought that those paragraphs should have been removed from the letter. And that's what we commented on, and that's what we voted on. And then at the end of the meeting was that we are going to formulate a letter and a response to the community at this meeting today. And I don't know that anybody was given any right to go out there and and give them a letter from the board on what had happened, because it wasn't our intention at that time to put a letter out or to put a response out. That's what today's meeting was all about. Thank you.
If I could, I just wanted to point out as well, I just point out the obvious, you saw the newspaper came out yesterday, you know, top of the fold, front page, article about us issuing an apology and rescinding that letter. So I think we did communicate to the community right there. So, so I think we've done that.
Excuse me, Jim, do we have some minutes or anything on this?
I'm
Because
sorry. Sure.
you know, I keep track of as much as I can understand and do on these meetings. Do we have a set of minutes of that meeting so we can verify that?
Mr. Chair.
That's what we did?
This is the clerk. Can you hear me? Clerk Spiro here?
Yes.
Those were the minutes from last Thursday. No, they're not complete. I can give you a review of what the motion was that was made by Commissioner Cherry, if you like.
Would you please?
So Commissioner Cherry, it was toward the end of that discussion item just before future agenda items. Commissioner Cherry motioned that a letter was to be sent out to the businesses in regards to what was done with the high-risk mitigation plan, that the portions about volunteers be stricken from the letter, and that the portion of the compliance sheet on the back sheet be removed from the letter. And he offered his recommendation that a statement be released to include apologies for what had occurred related to this an effort to address the mitigation plan. Deputy DA Maddox said that any statement by the board must be approved. So if a letter is to be done, it would need to be part of, you could make these comments today, but any action would need to be taken as a future agendized item. And he discussed back and forth the manner in which to make the statement via Facebook, radio, and newspaper. And then Commissioner Hill asked that it be agendized quickly so that information could get out to the public.
Thank you, Tammy.
You're welcome.
Thank you, Tammy. Mr. Cherry, Chairman Cherry?
Well, I'm at a point where I want to put this to rest. And I think I don't know how much more, like, it's in the paper right here, we did it, okay? Now, if the board still feels there's a need to issue any more, I'm good with this letter, and then that should be it. I mean, I agree.
I agree.
We can't keep this going. Dave?
Could you run that on up? I haven't seen the complete thing here.
Yeah, you are seeing it, right? You want it bigger? Is that what you're asking?
No, just run it up.
Okay.
You know, I know it looks like there's more to it.
It's on those pieces of paper too, if you didn't. It was on the agenda.
Is it on those papers there?
Yeah, it's on those right there. If we want to pull those up too. So you give you a hard copy, might be easier to see. Oh,
I don't see it on the agenda. The one I have anyway.
Yeah.
Oh, that's right. There was,
no.
Our system screwed up.
Yeah, we have some more, please.
So the one that's there is good. There's a letter on the back of each one of them. There's two sets, two stapled pieces. There's the agenda, and then there's the actual letter.
That's in there somewhere, Mayor.
Chair, can we take a 5-minute break?
Yeah, please. We're going to leave with, if you let us know.
Did you have a copy of it?
No, should be. Yeah, the letter's on the back.
Thank you. Ken? This is what we got in the mail. This is the agenda that was set out in the mail. That's why I'm such a loss as to seeing this. This is the first time I've seen it. I even talked to the DA about it. She said, you know, that Dave didn't put that on the agenda. So just for your information, okay?
Thank you. Welcome. Looking into that.
Yeah. Some of them. I agree.
Has the meeting resumed? The microphones are off.
Was that? That was able, yeah, we're back here now. Hang on one
Okay,
second.
great. Thank you.
To join the meeting again here. Oh, I'm sorry. Okay, we're ready.
Okay, we'll call this meeting back to order now. As far as our agenda item here today, does anybody have any ideas on a motion for this?
Mr. Chairman, I do. And I'll keep it short and brief because I've already flapped my gums too much today. But I think based on the article that was written, based on the conversation we had here today with the same folks that voiced the majority of the criticisms in the past, I really don't see a need for any additional letters correspondence going out. I think we've issued the apology publicly several times. And I just don't see a need, the need for any more of it. I'm like many of you. It's been trying and it's been difficult, and and I think it's the sooner we put this in the rearview mirror, the better. That's just my opinion, and I'm willing to make a motion to that effect if you're interested.
Do you have any questions before your motion?
I would concur with Commissioner French completely. I think it was me that suggested at the last meeting that we come back with a response letter. A lot has happened since that last meeting. I think that has been dealt with. There's nothing else to say. We've all gotten calls. We've talked to people. The message is out there. I don't think there's anything to add. It's been taken care of. So I concur with Commissioner French.
Commissioner Haas?
I concur also.
Commissioner Hill?
Yeah, this is Commissioner Hill. Yeah, although I did not know about the original letter, due to probably a lot of things being new, and I completely understand, trying to change of the guards of the commissioners and things happen, and the county still has to continue to operate and do business. I have also learned a lot in the last week about the other sides of the workings of the state, and through conversations with constituents and health, the doctor and stuff. I know a lot more than I did at the last meeting, so I would concur to that. We have communicated this out and we move forward.
Perfect. Commissioner French, can I get a motion?
Commissioner French, one more. I'm sorry to interrupt you. Could you maybe put something in there regarding us being in the Humboldt County Board of Health, so that everybody will know it's coming from the Board of Health and not the commissioners? Or do you think that's needed?
In my motion?
Yes.
Yeah, you bet.
Thank you.
Mr. Chair, this is Sheriff Allen. I would like an opportunity to speak as well.
Oh, yes, I'm sorry about that, Sheriff. My apologies.
All right, not a problem. I do agree with the motion. I also echo Commissioner Hill's comments that I did not know that letter was going to go out. But I also want to add to something that the District Attorney Maddox, or Deputy DA Maddox stated about having more guidance on press releases. And since we do have a couple of new board members to this health board, I think it would be a good idea if we would revisit what our duties and powers are as they are stated in NRS 439. I do think sometimes we tend to get a little bit of mission creep, and maybe this will bring us back in, or maybe everybody will agree we're on the right path, but I do think it might be beneficial for us all to be reminded and review what our duties and responsibilities are of NRS 439. Thanks.
Do you have that in front of you right now?
I do.
Could you read that?
Well, okay, and this is 439-350. County Board of Health duties. The County Board of Health shall oversee all sanitary conditions of the county in which the board is created. Adopt such regulations as may be necessary for the prevention, suppression, and control of any contagious or infectious disease dangerous to the public, which regulations take effect immediately upon approval by the State Board of Health. And then you get down into the County Board of Health powers. The County Board of Health may abate nuisances in accordance with law, establish and maintain an isolation hospital or quarantine station when necessary for isolation or quarantine of a person or group of persons, restrain, quarantine, and disinfect any person or group of persons sick with or exposed to any contagious or infectious disease that is a dangerous to the public health, appoint quarantine officers when necessary to enforce a quarantine, shall provide whatever medicines, disinfectants, and provisions which may be required, and shall arrange for the payment of all debts and charges so incurred from any funds available, but each patient shall, if the patient is able, pay for his or her food, medicine, clothes, and medical attendance, subject to prior review and approval of the Board of County Commissioners, and except as otherwise provided in NRS 556-128, adopt a schedule of reasonable fees to be collected for issuing or renewing any health permit or license required to be obtained from the board pursuant to law of this state or an ordinance adopted by any political subdivision of the state. Such fees must be for the sole purpose of defraying the cost and expense of the procedures for issuing licenses, permits, and investigations related thereto, and not for the purpose of general revenue. And if you go through this a little bit more, as I've mentioned at the last meeting, I do think it's important that we're not regulatory to city business licenses, or we don't have any say, in my opinion. Maybe Wendy can clarify that. But I think for that reason, it's so important that the city has a voice, or we determine the right course of action due to the majority of these business owners are in the city. And I think that their voice needs to be heard as well.
Thank you, Sheriff. Dr. Stringham?
I don't have any further comments. I agree with what's been said, that the board has apprised the constituency of exactly the way we feel about things. I think everything that needs to be said has been said.
Thank you. Commissioner French?
Yeah, Mr. Chairman.
There was a motion, didn't you?
Mr. Chairman, I'm prepared to make a motion. In light of the recent, this is Commissioner French off the Health Board. And in light of recent public hearings and the newspaper articles recently published, I feel it is unnecessary. A letter is unnecessary at this point in time, and I would not be in favor of preparing such.
Okay, we have a motion on the floor. Any questions on the motion? All in favor signify by aye.
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 Motion carries unanimously. Any public comment? No public comment? Councilman Mendiola or Mayor? Okay. Do we have any public comment
So I
online?
guess the sheriff brings up a question. I mean, I get where he's coming from on this. Can I talk about that?
Sure.
Okay. That city probably needs a seat on this board, right? I would assume. How How would we do that? Have to change an ordinance?
Yes, I can look into that. There is a statute, I think, and the sheriff brought this up to me. I don't even know what day it was, maybe Monday. And I just haven't had a chance to research that. I understand that the city may be interested in being on the health board. We do have also Humboldt County Code. The Board of Health is in our code in chapter 2. And it says that the Board of Health is the sheriff, the county health officer, and the commissioners. That law, I want to say, was back from I don't know if this is correct, but it says ordinance 8/14/1916. And it talks about the duties. Let me read you the duties just briefly. And it says regulations to best serve public health and cleanliness of the county, to assist the proper offices in the enforcement of the laws. And it talks about the towns of Lovelock and Winnemucca, if you want to understand how old that ordinance is. So
Can
I
I
can
ask
look
a
into that.
question, Mr. Chairman? Wendy, so how do we go about fixing that? Because I really do believe that the city needs a presence on this board for sure.
I'd like to have the opportunity to have some time to research that and figure out how we can make that happen, if at all.
Could you do that for us?
Of course.
Okay, thank you.
This is Commissioner Hill. I guess this is to Wendy. So could I ask now that something be put on the next agenda for the health board? Would now be a good time to ask that?
For something on the next health board?
Okay.
Sure.
So I would like to see put on the next agenda that we put together a list of city and county businesses, and we use that, we vote on it, make an agenda for that list, and then we all agree that that list is inclusive of all businesses, city and county, and that we use that list for further mass communication, I guess, or paper communication.
Yeah, good point. Yeah.
And then the next thing I would like to see is that we take action and give direction to what and how we release a mass release like that. A press release to the citizens or the businesses. I guess it would be more aimed towards the businesses, but that we take action and we agree on how that communication will come out in the future.
Which I would also include, put words in your mouth, but would include preparation of news releases. I would personally, like, in the same light, I would like to know, make sure that our news releases are consistent with what, make sure we don't have another one of these train wrecks.
Yes, and I think that's what we're trying to avoid is that,
Okay.
yep.
Okay.
Does that make sense? Do you need any
No,
clarification?
it does. I was just going to ask Wendy, Dave Mendiola, do we get in any kind of OML issues if we're sending out emails to everybody asking for their input like that? Like on a press release? We could talk about that in the agenda item, but that would be my only.
So, yeah, so when we have that agenda item next week, this is Wendy Maddox, purpose of the record, let's talk about that, because there are some press releases that you may want released urgently. Maybe it's positive cases, maybe it's deaths, and we won't be able to agendize those things because it's going to require, that we put it on an agenda, which requires 3 days posting prior to the meeting, for you to approve those letters. But if there's other things, like a letter that's going to go out next month, then we can definitely get those letters before you.
Okay. Yeah. And then
Sorry,
oh, go ahead.
in response to your email, I don't think it's a good idea for all of you to provide your comments in the same email to Dave or to me. And the purpose is I don't want it to be a serial meeting. I don't want you to see what Commissioner Cherry said and you say, yeah, I think that's a good idea and we should do this, and then us get into an OML violation.
Okay. And then the third thing I would like to see is as that was brought forward from the public today is a structured reporting structure that we agree on, that this is what's included in our reporting, and so a structured reporting.
A change in it, how we do.
Yeah, and I think there was some good ideas brought forward, with there was a template that went around.
Yeah.
With just a few things, let's keep it tight and keep it to the points, whatever we agree on, and I'm not trying to take any action here, but just we all agree that there's things that we report out and the frequency that they're reported out.
Okay.
Does that make sense?
How about also one of the other things I got out of this was some sort of a presence from either the chamber or somebody from the business community that would be able to provide input to us periodically, kind of like the school district does and the hospital does, have that presence on those agendas. I think that would go a long ways to opening the door for keeping this from happening again.
I believe that would probably have to come from the chamber because I don't know of any other organized group that could pick somebody or appoint somebody or maybe have someone volunteer that would represent a group.
Yeah.
So
Chamber would be a good place to start though.
I do have, before we go on to this, I have a public comment that was emailed to Karen. And it says, D. Mounts, just thank you, Karen, for all your help the other day. You're appreciated. I've searched for the commissioner's emails and can't find them. I'm sending you this information directly from Attorney Joey Gilbert. If you would forward to the commissioners, DA, county manager, it would be appreciated. Here's my message. Commissioners, please use White Pine's proven resolution for Humboldt. Humboldt must pattern themselves after a rural resolution and not cities such as Las Vegas and Reno. White Pine has already passed the legal concerns with their DA. All you have to do is adapt, vote, pass, and open the very same day. Please consider. I'm attaching scientific proof in Joey Gilbert's video. Thank you again, D. Mounts, and the links are listed here. Okay.
Yeah, I have a couple of things I want to bring up for future meetings as well. With the we no longer have any COVID funding available to us. It's gone, spent.
County's portion is gone.
Yeah, but that is what's paying for Nicole and Dr. Stringham. I think it may be prudent for us to talk about that level of, the contract of whether we can afford to continue at the present level or do we have to scale back. So I'd like that as a discussion item. I also was talking with another county and they have looked at, when COVID first started, we did a declaration of an emergency, which kind of kicked all this in, and that kind of puts the state involved once you do that as well. In terms of our declaration, the resolution and stuff, I think that we need to look at whether did we put a date on that declaration of emergency? Did it have an expiration date? Do you recall?
I can research it. I don't recall.
I don't recall.
You don't recall? We ought to look at that because if we no longer, if it is expired, maybe that's good. Maybe that's one way of getting the state out of our back pockets,
Very good point.
Okay.
Mr. Chair,
Yes.
Mr. Sheriff, I would like a comment on that. Although I do think that that is a good idea. The other thing that we would need to research, is that going to hurt our allocations on our vaccines? Because that is one of the ways that we are getting our vaccines is through the emergency declaration. But we can research that to see if I'm correct on that.
Good point. Good point, Sheriff.
That's all I have.
Wendy Maddox, in regard to contracts, that would be before the Board of Commissioners. And I think we can put that on the next agenda, as well as, we'll research the resolution before we put that on an agenda.
Okay.
Commissioner Haas, do you have anything?
Not at that time, not at this time. This is Commissioner Haas. Thank you.
Mr. French? Okay, any last public comment before we go? Anybody in the public out there on your phones attending the meeting virtually have any public comment?
This is Paige Brooks. Can you hear me?
Yes, Paige, go ahead, please.
As always, we appreciate all of you and all that you do. And I just know we've already chatted about this, so I'm not going to reinvent this wheel, but there are several businesses that did not take that letter wrong, and we do appreciate all the work. And I do know you're wearing numerous hats trying to keep the city, the county, the state happy. So I just want to make sure you all know that it is appreciated, and we do have customers that are nervous when we're not compliant. We have customers who are thankful when we aren't compliant, so forth. So I want you to know that as a business owner of 25 years and sitting in the seats where you all have, I just appreciate it. So keep up the good work, and I'll continue to listen. And I certainly know that we all can interpret a writing in many, many different ways. So I understand that too. So I appreciate what you're trying to do and you're doing. Thank you.
Any other public comment?
Mr. Chairman, this is Dr. Stringham. I just wanted to know whether I would have an opportunity to give a brief summation of our positions and whether that should be done now or at some future point in the meeting.
I think you could.
I guess I'm not sure what the question is. Sorry. If it's for public comment, I think Wendy Maddox purposes of the record. If it's public comment, I think, anyone can make public comment, including a board member. If it's something that's been talked about as far as on a future agenda, then we should wait until that agenda to discuss it. That helps.
Right. This is Dr. Stringham. I just wasn't sure whether or not I'd have an opportunity to say something later during the meeting, or whether the meeting is about to adjourn. I wanted to make some comments.
Why don't you go ahead, Dr. Stringham?
Okay, thanks very much. So essentially, I want to let the other board members know, and also members of the community, that, that essentially, I think there have been a lot of misinterpretations in the community of what the board does and the spirit in which our actions are intended. The first is that one person this morning, Catherine Hall, had indicated that essentially I have too much power, and she was concerned about the amount of power that I have. And I'd like to point out to everybody that this board is an advisory board, and the primary role that we've taken in our COVID response is that of educating the public rather than mandating various things. At no point, to the best of my knowledge, has this board involved or engaged in any mandating or controlling of the behavior of the public. We don't do things like that. A, it's not really the way we work in Humboldt County, and B, it's not the purpose for this board. The bottom line is that what we've done is we've delivered a message, and we've empowered those people who care to engage in doing the right things, but we have not mandated that those people who don't want to engage actually do those things. We've provided people with additional options, and at no point have we tried to commandeer anybody's actions, either in business or outside of the business community. Also, communication's been brought up on a number of occasions. This board has consistently talked about the good work that Humboldt County businesses are doing, and I've said on a number of occasions that a person is safer, a Humboldt County resident is safer in a Humboldt County business than they are in their own living room. And that actually is supported by the data. And ironically, that data was derived by the team that we set up in order to be able to collect data of that nature. So we could certainly have continued to use the state's screening committees as screening groups, but we chose not to because we wanted to get additional information for the express reason of being able to protect our county from various state sanctions and other actions. So I didn't get the feeling when I listened to some of the public comments this morning that people are really appreciating that. The other issue is that this board, and specifically I, am not a director. I don't strategize. Rather, I'm more of an umpire. I interpret the situation and figure out what it all means and what we should be doing. That's very different from being a dictator. And I really don't appreciate the way that some of the members of the community who spoke saw me as being a dictator. I wanted to clarify that. In terms of the the comments that were made about the letter and the intent, I think that it's critical that all members of the community who are concerned about this take a step back and understand that the letter at no point was intended to tell people what they needed to do. And in fact, I know others have commented, and I just want to add my name to the list. This was really a way to protect people and protect people against potential OSHA violations and agencies over which we as a county don't exercise control. We wanted to make sure that our citizens were not subject to various sanctions. And so that was the spirit in which this was intended. At no point did we take on a regulatory role or any interest in curtailing the behaviors that people wanted to do. Want to very briefly comment, I know the meeting's gone on for a long time. Did we really need to do anything at all? I know that there's still a large group of people in the community who really feel that nothing had to be done, that this didn't have to be managed in any way. And I would remind people that we've lost 471,000 people as of this morning. That's officially a number greater than the total number of Americans lost in all fights during World War II. That's amazing. It really is. It's a very large number of people. Several of us have lost family members. I have in South Dakota, and I know that there's at least one other person who regularly presents to our commission, to our board, who's lost a family member also. This is quite real. And I want to tell you what I see as being the score. According to the calculations that we did originally, and I think they're still valid, we've lost 13 community members. A lot of people say that's not very many, but the reason we've lost only 13 community members is precisely because of what we've done. It is not evidence that we've acted in a way that wasn't necessary. It's evidence that what we've done was the right thing. And the reason is because we've had 1,000 infections in our community, 13 deaths. It's about 1 in 1,000 people in the community in total, so thereabouts. And if we looked at all 16,800 people in the community getting this virus, the number of deaths expected would have been 200, slightly over that. And can that ever happen? Absolutely. It's happened in at least one of the correctional facilities and one of the state correctional facilities here in this region. The state conservation camp just outside of town went to 100% COVID positive. Every single person there got it. That could easily have happened in Humboldt County, and if it would have happened, we would have lost 200 human beings. And what I would tell you is we've lost 13. That means 187 people are still alive because of what we did. And what I can tell you is, given the total number of people who are listening to these comments right now, it's very likely that one of us would be dead. And, I just thought I'd mention that. To end on a bright note, I think this is pretty much in its final phase at this point, and I think all community members should take solace in the fact that the numbers are already going down precisely because of what we've done, not in spite of it. And I think with vaccinations and the warmer weather that's coming, we have every reason to believe that within about the next 120 days, this is going to look really good. And I know we can get back to our lives as they have been. So we are not fearmongers. At no point have I attempted to make people afraid of something that they shouldn't be concerned about. So I think that we've done a good job, in my opinion. I'm very proud to have served with this board, and I think the future is looking very bright. Thank you.
Thank you for your report, your comment, Dr. Stringham. Any others? All right, then we will adjourn this meeting at 11:40.
Thanks, everybody.
Did you log off?
Hey, Dave.